Good morning, viewers. I, Dr. Pooja from CSIR CSIO Chandigarh, along with my INYAS colleague, Dr. Pankaj from IUAC New Delhi, welcome you to the 9th webinar of INSA-INYAS webinar series, Vigyan Setu. Science communication has a pivotal role to play in reaching the masses as well as in inculcating a scientific temperament. COVID-19 has made us realize the importance of science and technology for survival of the human race. It has also changed the landscape of science communication. Besides, it's an opportunity for scientists to strengthen public trust in science. COVID-19 has changed this perspective not only for scientists, for science, as well as for the scientists, for human race, which is looking up to science for solution to end this rampage of novel coronavirus across the world. Today, to speak and elaborate on this, we have with us Dr. Subhra Priyadarshini, Chief Editor, Nature India. She will talk about lessons from COVID-19 for science communication. I request our viewers to post their questions related to the topic on the YouTube chat, which we will be taking with the speaker after the talk. Before we start the webinar today, it's our pleasure to have Professor Shobhana Sharma, INSA Honorary Scientist, ICT Mumbai, and former Senior Professor and Chairperson, Department of Biological Sciences, Tata Institute of Fundamental Research, Mumbai. I request you, ma'am, to introduce today's speaker. Over to you, ma'am.
Thank you, Pooja. It has been a pleasure to have this task of introducing Shubhra Priyadarshini. Communication is an extremely desirable and a very powerful art. As Edward Bulwer Lytton said in 1839, a pen is mightier than the sword. Most scientists perform very poorly when they have to communicate to a wide audience. And the task of bridging this communication gap is typically neglected in India. Yes, certain major newspapers have science columns which do cover some part of it, but in this age of media connectivity, that is simply inadequate. Persons such as Shubhra Priyadarshini are required to spearhead a closure of such communication gap. Shubhra Priyadarshini is the chief editor of Nature India. She joined Nature India after a decade-long stint with the mainstream Indian media. Shubhra has a bachelor's degree in zoology. She majored in personnel management and industrial relations from Utkal University. A postgraduate from the Indian Institute of Mass Communication, she also studied print journalism at the University of Westminster, London. She was a correspondent with major Indian dailies, the Times of India, the Indian Express, the Asian Age, the Telegraph, news agency Press Trust of India, and Down to Earth magazine. Though she chased deadlines to cover politics, sports, fashion and films, crime and natural disasters as a journalist, she kept coming back to her first love, which is science. Nature India is her first online venture, and it has been extremely successful. Shubhra has been a British Chevening Scholar, a Robert Bosch Fellow, an IREX UNESCO Fellow, and a Kavli Prize Media Scholarship Awardee. She has also received the BBC World Service Trust Award for her coverage of the vanishing islands of Sundarbans in the Bay of Bengal, and the Panos South Asia Media Excellence Award for her incisive coverage of the climate change issues. She won acclaim in India for her coverage of the Orissa super cyclone in 1999 and the Indian Ocean tsunami in 2004. Shubhra has been on the panel of many international committees and meetings on science communication, environment, health, and climate change. She was on the program and selection committees of the World's Conference of Science Journalists to 2017 and 2019. Shubhra is a member of several government groups and panels on science communication and policies, and is an executive member of the BRICS Young Scientists Forum. Through Nature India's many workshops and outreach activities, She trains Indian scientists in science communication and presentation skills. She now helms the Nature India Wellcome Trust Science Media Fellowship for India, the only such in India. Today, in this INSA-INYAS Vigyan Setu webinar series, Shubhra will be talking about lessons for COVID-19 for science communication. We welcome her to this forum and look forward to her talk. Over to you, Pooja.
Thank you, Professor Shobna. May I now request our speaker, Dr. Subra, please share your slides and reflect upon today's topic.
Thank you for inviting me, first of all, and thinking me appropriate of delivering a talk of this nature, which actually encompasses a whole lot of other things beyond communication. So the first thing that I wanted to mention here is communication, of course, is something that we have all been doing in bits and pieces at some point of time, right? And many of us may have had some training in communication. Many of us may not have had that training in communication. But by and large, communication as such is, put in very simple terms, is a basic to and fro between your audiences and yourself. So without further ado, as they say, let me just share my screen and perhaps is this visible now?
Yes. Just make it full screen, ma'am.
Right.
Yes.
Yes. So what have we actually seen during this pandemic, and what lessons do we learn from it as communicators, as journalists, as scientists who are into communication, and as professionals who are dedicated to communication of science? My perspective is primarily from somebody who's in the journalistic field, somebody who's been in the thick of communicating science through journalism and through my roles as the editor of Nature India for the last almost 14 years now. What I will bring to you today also is my close association with the scientific community and what I've learned during all these years of being together with the community and how they cope with the challenge of communicating apart from doing all of the other things that they do on a regular basis. So how are the number one lesson that we all take away from communicating during a pandemic such as COVID-19 is how to communicate uncertainty, because that's all that we have on our plate, right? We have all the imponderables. That's the biggest word, or uncertainty, that's the biggest word throughout the COVID-19 crisis that we have come across. The imponderables, the questions that are constantly being framed in science, the questions, the problems, as you call them in the scientific community, that are constantly being asked of science, and the answers that are constantly being sought through science. We all have realized through this process of learning and learning that it is an uncertain world as far as COVID-19 is concerned, and science certainly isn't constant, and that reflects constantly in our communication of uncertainty around COVID-19. COVID-19 has played science out in the public gaze far more than ever. So this is the moment for scientists and science communicators. We have all seen how science has taken center stage, put on the spotlight, if you will, and everybody from the man on the streets to the policymakers, governments across the world are all looking at science for answers to unravel the mystery that the virus and the pandemic itself have posed to us. So therefore, it is important to communicate the unanswered questions that lie before us. And of course, the limitations that science poses alongside the hope that we communicate to people. So all of this really needs training. This needs basic understanding of the fact that it's not just the hope that people need to be communicated to, the hope of science or the answers only, but also what lies beyond those answers. How concrete are those answers? Whether there are limitations in science that we must be aware of. And there you have on the screen something from Scientific American that was written by a PhD student about budding researchers and what he himself learned from that, the process of trying to communicate science during COVID-19. I urge you all to have a look at this piece from Scientific American, which talks about the do's and don'ts, and the faltering, the getting up, the many lessons that one has learned during communicating a pandemic. That brings me to the second lesson of emergency risk communication. How should it be? What should we be looking at while we communicate the risk of such an emergency, such a crisis that has befallen us across the world? And so during such a time, communicators who are professionals in the field actually advocate direct, understandable, practical, and quick approach to communicating risk. They advocate real-time evaluation of whatever we have done as communicators when we do such a direct and practical and quick communication. What is the effect on the audiences that we are communicating it to? And doing that evaluation real time is something everybody advocates, everybody who's deeply entrenched in emergency risk communication advocates. And then refashioning that communication real time, if it is working or not, helps. So for example, we can take these examples from the right kind of masks that were advocated in the beginning, and then how the narrative changed midway, and then how we know better as to what kind of masks we should be wearing, how we should be wearing them, what is the difference between a symptomatic versus an asymptomatic patient of COVID-19. And of course, there lies a whole host of things to do as regards misinformation and myth busting of things that do not fall in the purview of science, which are basically pseudoscience or fake news, whatever you have being perpetuated by the social media or WhatsApp. So that is something we have to be very aware of and quickly communicate as scientists. And I'll come to that in a bit about what we should be doing as a community of scientists who should be rising up to this kind of emergency risk communication real time. Two of the other buzzwords during this COVID-19 that have hit us hard and which keep coming back to us, especially in countries such as India, where we have been demanding as journalists and as the scientific community, transparency and honesty in communication from not just our policymakers, but also from the wider scientific world. Transparency and honesty in communication. What does that mean? It really doesn't hurt. It actually aids the communication process if we can say and stand up and say things like, sorry, we faltered, or sorry, we don't know much about this fact of life or of science right now, or this is exactly what we know about this as of now, and this is an evolving process. Science evolves as we know, and what we know in the fact of science or the rigors of science is this much today. and tomorrow we might know better and we will communicate that to you. So saying that upfront and honestly and transparently does help in the communication of science. Clarity and openness in sharing real-time data only helps better governance and better handling of a pandemic. That is what we have learned very quickly through this pandemic. It helps in creating not just public trust in science and an atmosphere where people can support and abide by the regulations that policymakers create and enforce, but it also helps in quickly seeing change in how the pandemic curve looks like. It helps in involving the public in taking decisions by arming them with gently with scientific facts, and it helps in bringing science down from those ivory towers to the lay people who may not have too much knowledge about how science works, what is happening today in the labs, and what might happen tomorrow if we were to take it to the public. Brings me to another lesson that we quickly learned in the COVID-19 crisis, and it is how we can use data creatively as scientists and as science communicators. So you see, that is a curve that is very well known today, and the nomenclature, the scientific term flattening the curve is now no longer a scientific term. It is percolated down to the public very quickly and easily, simply because curves like this and the communication of science through things like this have really, if you will, taken science to the public more effectively. We can tell a story with that curve very, very quickly and successfully. This is an iconic curve, as it were, and this chart illustrates the power of data-driven storytelling in the public. It's possible to communicate urgent health and hygiene information in ways that prompt people to take action, and that curve is actually a very good example of that. It was a simple chart that actually made its debut in journal articles, and it was shared by newspapers and magazine, and then refined to clarify the message of flattening the curve even further. It was translated into many languages and creatively reworked into animations, cartoons, and even cat videos. And we've seen some of those videos. I wish I had time to lay out some of those videos here, but yeah, we have seen that curve actually being translated from scientific jargon to being used in public communication of science very, very effectively. It can drive social change safely, responsibly, and ethically. All of those terms are not loose terms. They have to be weighed in their weight in gold, and they actually make for what we call effective and safe communication of scientific jargons to the public. Which brings me to another lesson that we learned as a collective of science communicators very early in the pandemic. We learned that the pandemic is not just about science. It is an interdisciplinary approach that will help us in communicating the science. COVID-19 really showed us a mirror to all the science communicators, that communicating just science in terms of peer-reviewed science or through the mouths of scientists, biologists, epidemiologists, and data scientists is not just it. We really have to show how tightly science is intertwined with society, with economics, with politics, and all of that really played out again in real time very effectively in front of us through those pictures of migrant laborers trying to make it to their home back safely, of pictures of patients not getting health care very quickly, and suffering from the evils of COVID-19, many unknowns of COVID-19, from the many unknowns of the virus. So that was something also that very effortlessly came into our coverage of the science of the pandemic, and also in how scientists were communicating science. They were also lacing their communication with a lot of these facts of life. So it's a super connected world and we found out that peer-reviewed science and fiction or conspiracy theories traveled at the same speed, and many times the conspiracy theories actually traveled faster than peer-reviewed science. Misinformation, as was mentioned earlier, really needed real-time squashing, but scientists were, as we know, very busy doing more important things in the labs. And so to come up to speed with that misinformation and to really be armed with science and come and say, hey, we know for sure that this is pseudoscience, this is not something that we can perpetuate as science, was difficult for scientists to begin with. But that is the essence of how we have to be one step further of misinformation, how we really have to step up our game as scientists and science communicators, and make everybody see that science evolves as fast as misinformation does. And so to really break up that science that happens in the labs for a lay audience and bring it to them in real time is also a challenge that scientists have to come to terms with and do better in times to come. And the lesson that we learned from this is actually interdisciplinarity is the future of science and science communication. All of you know this person, Jacinda Ardern, and you know her because she is actually in herself a masterclass in how science must be communicated and the uncertainties of science must be communicated. And I picked this picture from some hours back on Twitter because it shows her in a temple in New Zealand trying to communicate effectively to an audience that is beyond, just New Zealanders. And she's here seen in this picture, wearing a bindi and an Indian attire, eating chole and puri and halwa and stuff like that. And so that's actually mingling with her audience, and she did a fairly wonderful job of among many politicians of going down there and saying, hey, this is the science we know as of now, and tomorrow that science will evolve. And that's a quote from her from some days back. Without our science communicators to publicly inform, explain, teach, decode, counter misinformation, and debate science matters, many would remain in a space where they don't have the information they need, leading to poor choices being made at really crucial times. Really, it's all of that sums up what I want to say today in so many words. It speaks to us about the choices we make in a pandemic. It speaks to us about how science must take center stage in these really crucial times, and how science communicators have a really big role in busting myths, in creating that space for informed choices to be made by everybody. So she did a fairly good job of explaining in these very many words to all of us about what we should be doing in times to come in emergency risk communication. So I'll end today's chat by giving, these were some lessons that we learned, and now I just switch to giving a short sort of to-do list, or if you will, what can you do to make a switch from being just scientists and young people in science to coming over and being great science communicators. And this is just a representative list of what you can do to begin with, and then you can find your way around the many labyrinths or many mazes of science communication, and many ways creatively of how you can do things. So first up, you could involve people from multiple fields, and we talked about interdisciplinarity, especially your own press office, if you have one, includes scientists with public communication experience in your own way of finding through the maze of science communication, finding your way through the maze of science communication. You could very easily visit a newsroom, and it's a great time to do that because you'll see the buzz in newsrooms. You could ask one of your friends in the scientific journalistic community to take you to a newsroom where you could request to sit in an editorial meeting and see how journalists actually pitch their stories to their editors and what they do during such pitching. That would give you lessons in how to do your own pitching about stories or articles. You could get hands-on, write a press release yourself, or articles, or conduct interviews with scientists yourself, or get interviewed by a journalist or a communicator of science, and create a web page or a blog. And there's no end to how creative you can get with your science communication, or reaching out to the public in your outreach program. So some of these things you can adopt very quickly and figure out your way through science communication. And I'll end here and take any questions if you have.
Thank you, ma'am. First of all, I would request you to stop share screen, and then we will go ahead with the questions. Yes. First of all, thank you for such an interesting talk on science communication. So the first question which comes is related to how science journalists handled misinformation, pseudoscience, and wrong science during the pandemic.
Thank you, Pooja, for that question. I mean, it's about science communicators and journalists actually handling pseudoscience anytime, not just in a pandemic. How do we do that? How do we go about it? It's very, very essential for science journalists to be rooted in science. That's very evident and obvious. To create a backbone for every article we write, every content we create, a backbone of science, really. So what do we do in order to, in times of a pandemic, it actually went 10 steps ahead in trying to figure out which are the good sources of science in real time, in trying to figure out what could be a piece of fake news, in trying to figure out more importantly what not to cover than what to cover. So how did we do that? We relied on peer-reviewed science mostly, and of course preprints also made a great debut during this time. We knew preprints earlier too, but we saw a whole host of preprints being thrown at us in these times, and our policy was to basically really cover preprints, but to get all preprints verified by experts in the field simultaneously. So some of the tricks that we adopted during the COVID-19 times was, one, to stay away very clearly from what appeared like pseudoscience and fake news. And science journalists are trained to do that more often than not. Also to verify every piece of news in real time by experts in the field, and not to go to a cardiologist for an epidemiology story, really. That's an example that I gave because lots of media houses actually did that kind of stuff. So yeah, to answer your question, we fell back upon hardcore peer-reviewed science to make our narratives.
Right, ma'am.
Thank you. Thank you, ma'am. So one question is that how ethically bound is science journalism itself?
Okay, that's a great question. It's as ethically bound as science itself is. I would say that good science journalists and good scientists are very much alike. They both, test their theories very, very rigorously. They both form hypotheses and test them in real time. They both write for an audience, and their next they are as good as their last article or their last story. So a bad story or a bad piece of reportage could actually mar your career, just like a bad piece of manuscript could mar the career of a career scientist. It's just the same. So ethics is the core of any profession, and there are lots of things that we value as science journalists, just as you value as scientists. And we have to really check all of those, tick all of those boxes before publishing a story. Um, if I am clear enough on that, did I answer your question?
Yeah,
Right,
of
ma'am.
course.
Yeah. So going by the next questions, it is said that presentation of fact is not always the same in media as it is there in the science journals. So facts get twisted. This is a perception. Facts get twisted often when presented by news media. What is your take on this?
Yes, I do agree. And very often, what we see in newspapers or in headlines in newspapers is very different from what you as scientists have, toiled for 20 years and produced a paper which got distorted in the popular media. And you have to understand why that happens. And that's where, coming into a newsroom generally helps. And I advocate that very, very seriously with scientists, because you have to understand that media houses really work in with many, many limitations. And one of them is really the commerce of the media houses. The many things, it's basically a newspaper many times is a product rather than a vocation. It's a profession that journalists are taking up rather than a vocation. Earlier, it was a vocation for many, and so what has changed in the media scape now is primarily two things. One is it's led by commerce, and many decisions that newsrooms take may be driven by that commerce, that propensity to be in business. Second is the fact that many stories have a space constraint. So what you have done in a 20-page manuscript has to be reported in, say, 200 words or say 500 words. And if the paper is generous enough, the newspaper is generous enough, they'll give it full coverage, like a full page or something. So what you have toiled hard for 20 years to achieve, a news reporter is basically working on a deadline and trying to write it in, say, several hours with pictures and graphics, and trying to understand how your science evolved, etc. So he or she has to basically be driven by the news points that you give him. So there's a lot of responsibility on scientists here to inform that narrative and to create an atmosphere, or to create a narrative that the reporter or the journalist can very easily understand and not misreport. So half of the onus is actually on scientists to clearly communicate, cut across those jargons and tell them, see, this is what the headline might look like, or see, these are the key points that you should be aware of while reporting. So that's something that is a to and fro, and it's actually a 1 hour lecture on how we should be dealing with journalists and how we should be communicating our scientists to the journalist first effectively so that he or she can communicate it to the wider audience.
Yeah, not an easy job. Okay. Going on, editors of The Lancet and the New England Journal of Medicine recently revealed that pharmaceutical companies are so financially powerful that they pressurized them to accept papers about the negative hydroxychloroquine studies. What is your take on this, ma'am?
Well, I think there are two aspects to this. One is I see retractions as very healthy. It's a way of saying sorry by the journals, and saying sorry is good. It's essentially meaning that they realize where they went wrong and they owned up, and they said that in real time, and they, unlike many governments or policymakers who are wary of saying sorry, even for the hydroxychloroquine case example that you mentioned, many of us have still not said sorry for implementing it at large scale, the use of hydroxychloroquine. So if a paper has been retracted, it essentially means they have followed the tenets of science and of doing peer-reviewed science, and they have acknowledged that it was an oversight on their part. As far as pharmaceutical companies being powerful, yes, they are powerful, no doubt, but to influence science through this kind of thing is in my view difficult. It was an oversight at best, as I can put it. It wasn't really something that and people have pointed this out very quickly and very effectively for the journals to have withdrawn these articles, retracted these articles. I think that if they were very powerful, this retraction would not have happened. So it goes both ways. Yes, there is some power that they wield, but as we have seen in these cases, the power didn't really go beyond a certain point, and these articles could be retracted.
Right, ma'am. So in this COVID-19, the visibility of science and scientists has increased a lot. So how do you think that India is well prepared for effective science communication? Generally, it is thought like communication is more from celebrity than a scientist. So how can we address this?
This is one of my pet peeves, and I have been advocating for this for the longest number of years that I have been in science journalism and communication. I can't advocate enough creating of rock star scientists in this country. Just as there are rock star sports persons, there are rock star film actors, and what they say makes news every day. There are rock star politicians. So why not scientists? Why isn't it that we have these powerful voices in science? When they speak, everybody hears. Why can't we create an atmosphere like that? Why isn't that scientists have really created, people who are powerful, whose voices transcend the voices of politics and powerful lobbies, and they can stand up to the scrutiny of all that means news, or add value to public discourse like we would see from any other sphere. Of course, that's changing, not as quickly as we would want, but there are now, groups like we have seen during the COVID-19 times also, the INSA-INYAS group, which has come up very effectively and said things like they are, and made their voice heard in the policy making spheres. They have issued how much change they have been able to bring about is another thing, but they have at least stood up and said things like they are. And we really need more of this in coming times, and we really need more teeth to the academies as well, where they stand up and produce these effective policy papers, stand up and say, well, see, this is pseudoscience being perpetuated by a politician, if not by anybody else. So, and also I have been part of the science policy formulation task force, etc. And I've been on the track of science communication in this policy, and I've said this very vociferously, that there should be a place or a committee of sorts in the government where any politicians who's going to talk about science has to come back and refer to these people and say, look here, I'm going to talk about this. Does this sound scientifically sound? Is this something I can go to the public with? And then the committee has to ratify that, and then he or she can open his or her mouth in public about science. So some mechanism, if not a committee, some mechanism whereby all of our pseudoscience in public domain can be scotched effectively needs to be placed.
Now, how do we get students of science motivated to take up science journalism as career?
First up, it has to be understood that science journalism is not an alternate career for scientists. It is a full-fledged career. People like me earn their breads and have been earning their bread from science journalism for long years. And it is a legitimate career option for anybody, not just scientists. It pays well in many parts. If you're a good science journalist, you have 1001 avenues of going freelance or working with a news media, or working in public policy as well as a communicator. So really, it is a field that needs more understanding by scientists themselves. As I said, go into a newsroom and see real time how news unfolds, what science communicators do, what science journalists do to earn their bread, to write a piece that is laced with solid science, has a background of a peer-reviewed science, or talking to scientists, or going into conferences, all of that. So one thing that we can do to start making, giving value to science journalism is really breaking this myth about it being an alternate career. It is something that any of you can adopt, any of you can go into, and it doesn't really need a science background to be a good science journalist. The best science journalists across the world are non-scientists. So it is something that all of us have to realize and understand.
I would like to make a comment about this. May I?
Sure,
Yes,
ma'am.
sure.
Yeah. So, one of the main problems of scientists is that the kind of requirement by the media, which is like the bottom line, or, the best message and so on, is often not thought about by a scientist. I mean, the scientist writes a paper with all the facts and data and interpretations, and they can be long interpretations. So this is a problem, and I think this miscommunication is a major one, and the journalists want some meat, some message from scientists, which doesn't often come. And I think this is a training that is required even in science curriculum. And maybe one should, because we should be able to communicate to the public in terms of general language or lay language. And I think scientists lack it quite seriously.
Absolutely, very valid point. And that's where the miscommunication really stems from. If we aren't really sure about what we can tell, this is a very general example that science communicators and science journalists give. And I'll give it to you, despite being repetitive. I've said this in many fora. And many of my friends who are journalists also say this. If you can communicate your science to your 10-year-old son or daughter, or your grandma, what you do in your lab, you would have understood that it is good to go to the media. So if you go back home and do this exercise one day, get hold of your grandma and tell her, Grandma, this is what I do for a living. This is what I do in my lab. Or this is my new paper. This is what it talks about. Your grandma will ask you 20 questions which she did not understand that you told her. Or your son or daughter will also ask those 100 questions about what you do in your lab. So what scientists do in their labs or do for a living is an enigma to people beyond their lab. And so trying to make it understandable to this kind of an audience actually helps. It helps to break your message down to the low, to be able to bring it to the lowest common denominator, if you will, and how it can be really relayed to somebody who's a man on the street or somebody who's totally unrelated to your science. So increasingly you will find that science journals also ask you to write your abstract in a manner that can be understood by a, if you're a biologist, it can be understood by a astrophysicist, for instance, something like that. So doing that exercise helps, and doing that exercise actually makes you realize your key messages that you want to deliver to a journalist or to somebody in the media. I hope I answered your question in some way. Okay.
Right, ma'am. I think instead of technical jargon, we need simplicity when we communicate with the common public.
Absolutely.
Yeah. So I'm going back to the next question. So like we hear from prominent scientists of the country that ancient as well as modern Indians have made discoveries, but they haven't been recognized as the first ones by the Western world. What is the take of Nature India on this?
By the Western world, I would say maybe it means by journals itself in the West, which are produced in the West, or maybe we are not taking into cognizance the fact that something originated in India first, and then. So this is an age-old debate that we keep facing, and this question is asked many times about why an Indian discovery or finding did not make its way to a peer-reviewed journal before something that was done in the Western world. I think there are several aspects to this again, and I've been studying this very closely, and I'm writing a book actually around this very subject, comparing the lives of two scientists, one in India and one in the Western world, and the thin line of peer review that actually separated the lives of these two scientists. And so what I've found in my research is very often we haven't really gone through the rigors of scientific publication and documenting and saying it as it is in scientific terms before making our science public, taking it to the public domain, whereas the Western scientists vouch by that as a gold standard. So some things that we do not do in India are standard practice in the Western world. And through the example that I am studying in the in vitro fertilization science is I found that the scientist or the medical researcher, physician, medical researcher who actually founded some of the theories way before IVF became big and a Nobel Prize was awarded to one of the people who founded, who first discovered IVF in the Western world, was that the difference was that the Indian scientist or medical researcher really didn't do all the peer review, really didn't put everything in place before making an announcement in the media. Whereas the Western scientists, his Western counterparts, were working on similar things, and they approached the issue in a much more grounded way scientifically. And that's why one went away with a Nobel Prize, and the other was hounded into committing suicide at one point of time. So you see, it's this stark, the difference. And the other thing that I want to mention here is also the idea that Western journals are biased towards Indian studies and they don't give too much importance to it. I don't know how much truth is there in that story, because as far as I know, and I've seen the process of peer review from very close quarters, and I can say that people actually fall back upon the rigors of science and the methods and protocols, and the reproducibility, of course, of science when they look at those manuscripts. So I don't have a straight answer to that one, but I do know that nobody consciously thinks of this as an Indian study, and we see several Indian studies being published in Western journals now, way more than they used to be earlier. So what brought about that change? Certainly not a viewpoint change in there. So I don't know how to answer that question directly, but I know that the backbone of every study is, as we know, rigorous methods and protocols and reproducibility, and that's what most peer-reviewed journals look for.
Yeah, thank you, Dr. Subra. Now we will take our viewers' question one by one, and we will try our level best to pick up maximum questions allowed in the available time frame. So the first one is by Shreya Ghosh. She is asking, how can science journalists hold public policy makers accountable for whether or not their actions and policies are based in science?
Okay. Yeah, I think the only job that science journalists can do is to write or create content that questions public policy if it is not grounded in science. And we've seen a lot of science journalists in India, across the world, do that during COVID-19 times. I don't know how effective that was, whether that really made a change and that's actually a good study to do in the sphere of science communication, of whether the science stories that were told during COVID-19 actually made an impact. For instance, hydroxychloroquine, while we know that it is no longer being prescribed by the WHO as standard practice or by many governments, we know that some governments, including ours, have not gone back on their stand on hydroxychloroquine. So despite our writing several times or creating content in audiovisual media and advocating for bringing this whole debate to the center, to the eye of the storm, even then several reversals that should have happened haven't happened. So really, some things will happen, some things will yield results through our reportage, make an impact, and it has been true for however number of years science journalism has thrived in this world, we have made impacts with some stories that we have done. We haven't been able to make impact in others. And that's where I think even scientists' advocacy comes into force. I think if scientists come more openly into public domains with their stories of scorching pseudoscience, with their advocacy of science in the face of this kind of pseudoscience being peddled or fake science being peddled, then it's a two-sum that might make more impact than just science journalists or communicators doing this job. And I know of a lot of science journalists who are going beyond their mandate of doing just stories. I have been involved in a lot of advocacy online in meetings like these. I've been, despite the fact that we are so hard pressed for time to review articles after articles, look at evidence to report, commission stories on real time, look at all kinds of evidence from across the world in science to inform our own stories that we write with deadlines. Even then, I have gone beyond this mandate of sitting in my cozy space of writing stories and really gone to advocate stuff. So I think it's time for the scientific community also to take up these cudgels and do all of this advocating in real time.
Right, ma'am. So the next question is from Anirban Basu. So like in COVID-19 time, we have seen that media is flooded with various news, while only a little of them has actually been materialized. So his question is, nowadays, some people overinflated their science in press and media. Is it ethical, or how we will take care of it?
I missed the last part. Nowadays, some people
overinflated their science in press and media, like we have seen in COVID-19 time also. So is it ethical, or how we will take care of it?
Yeah, very good question. So I can talk to you about my perspective of what we did very quickly in the COVID-19 times, how we informed our coverage. So very early in the pandemic, we decided on a editorial policy of how we are going to do it, and we informed our choices really with by looking at uh, science stories which had a global impact, which had more than just India at the core. So you know that science is universal. You know that any science that might be happening in COVID-19 times will have an impact on somebody who is sitting in, say, a small village in Tamil Nadu, as much as somebody who's sitting in Wisconsin, Madison, for instance. So science is universal, and that was something we thought which would be reflected in our coverage. The key challenges that we faced was competing with
I think some issue with the Dr. Subra's internet connection. So please stay tuned. We will get back.
We may have some remarks, some comments from Dr. Shobna until then.
Yeah. Would you like to say something, ma'am? Yeah, please.
Sorry, am I audible now?
Yes, you are.
Sorry, the internet connection went off. So yeah, so I was saying that the key challenges that we have faced in covering the pandemic till now is competing with so many other global media on a science story, when of course usually nature India is one of the few focusing deeply on science. We had to be the speed at which the pandemic was changing very quickly at the beginning, and the papers continued to flood out the newsrooms. So deciding what to cover and what to leave, that is triaging basically this flood of story ideas, and how to prioritize our limited resources of reporters, and at Nature India it was just me. So how to sort of prioritize the stories that we wanted to focus on. That was something we started doing very early on. All of a sudden, we had to also report from home, sitting at home, with many of us having children or caring responsibility. And something that is not stressed very often is the mental health of journalists and editors. That also took a toll during these times. And that also was something that we reflected on very seriously. So even if it meant, sort of missing out on some stories, we didn't really mind our journalists not coming to the fore and missing those stories out. It was perfectly fine if we missed some very important stories. We could report on them the next day. So really taking care of the mental health of our staff and people was also a key challenge. So keeping in mind all of that, just as any other profession suffered due to the pandemic and coming to terms with the realities of the new working conditions, we also suffered massively. And so it took some time for us to come to terms with this also. And so we got in touch with our reporters, and tried to find out two things. One, informing our editorial policy through what was desirable, what is adding value to an original angle. So that would mean we would leave out a scientific paper or a story that every other news media was covering, and we didn't have to add too much to it, right? And also focus on research and researchers only, and leave out the other stuff. We also wanted to offer authority and depth on key issues about the pandemic, rather than reporting everything that was happening out there. So that was one thing we did. And we also thought, including data was something that was essential for all our coverage, all our stories. It had to be international in its scope, and also show why this issue mattered internationally, and was to be having a backbone of solid data.
Yeah, thank you, ma'am. There is a question from Upasana Ray. She's asking, many times science communication is also politically influenced. How do you handle that? And whether it has happened with you in past?
Good question. And I will answer the first bit first. Science communication as such, for me, hasn't really seen this effect, of being politically biased. Because essentially, science is something that will have to be, placed in real time and in science. So there is no way that you can inform your communication or journalism of science issues through a politically distorted view. However, I have had instances where I have reported other things beyond science that were influenced by the politics of the newsroom and the politics of the country. So yes, many times, and I'll give you one example, maybe from science itself. That was there wasn't much in science, as I said. But one strong example that I can give you from a non-science story is when I reported on an issue of where the UPSC results were rigged, and there was a leak in a paper and of UPSC, and then somebody informed our newsroom about, and I was working with a news agency at that point of time, and we were told that so this paper was already available to people in the public domain, and somebody, it wasn't the day and age of cell phones, so somebody actually emailed a scan of that paper to us, and we very quickly started investigating it, and we found that that was the case indeed, and we reported the story in the news wires, and the story had to be taken down because the political establishment was obviously unnerved by the story and wanted to investigate it before the story could be made public and before anything else would be told about it in real terms. It actually turned out to be a true story, and much later in life, but at that point of time we had to bring down that story because of political implications. So yes, there are many such instances that I can quote, but this one comes to my mind. However, in science journalism, I haven't really seen too many such stories. I have seen just one, but that was more because of the legal implications of that story might have had than of political implications. So, yeah, these newsrooms, as I can tell you, certainly not mine, are influenced many times by how a particular news story will field out, and it includes science news stories. I did mention some of the reasons why stories appear in print or content appears in audiovisual media the way it does, and some compulsions do exist in many newsrooms, yes.
Right, ma'am. And thank you for clearly explaining this. So we have next question from Rajendra Reddy. He's saying, isn't confusing for common people because of too much information from different sources?
Absolutely, it is. It is confusing for journalists as well. People who bring you those stories,
I'm sorry, viewers, we are again stuck because of.
Yes, of course it is. It is too much.
Ma'am, your
Can you hear
internet
me?
connection is fluctuating.
Okay. So just give me a couple of minutes to switch over.
Okay, fine. Till then, we will probably talk to our guest, Professor Somna Sharma.
Sure. Do let me know if you can hear me, and then continue.
So whenever you are okay, we can start.
I'm fine now, I think.
Oh, okay. So then please continue.
Sorry, Shobana, I'm snatching from you every opportunity.
No issues. I'll make my comments.
Please go ahead anyway, if you want to.
No, we'll ask at the end. We will.
Yeah. Okay.
Please go ahead, Shobana.
Oh, so I wanted to make a comment on your last issue about politics or such interference. Clearly, there are such pressures. For instance, ICMR coming up with a COVID vaccine by 15th of August. This was sensational news, and turns out that it was a very hopeful news which media was propagating through various channels. And all that they were doing was to go into clinical trials. And, essentially media, or essentially people are so eager to hear what they want to hear that that sometimes forces media to put the news also accordingly, which is far from scientific truth. So
Absolutely. Yes. And I haven't seen a responsible media house really play up that news. They said it as it was, because I have seen a lot of news reports coming out of that ICMR letter, which was very strong in its tone, and it also and a lot of media houses that I have seen, and a lot of science journalists and healthcare journalists actually reported it as it is. They said these things. They did say that this sounds like a bizarre proposition. This sounds like something that cannot be achieved by August 15. This sounds like something that is a dictum handed over by ICMR to the labs. And so I was very, very, very happy for that coverage that media houses made. So it actually makes a very strong case of how that ICMR report was, outright rejected by media houses and reported in its true tenor, like it should have been. Some of the nationalistic media houses, or jingoistic media houses, which you anyway cannot rely at first sight, did report it like the way you mentioned. But then you as a discerning reader also understood that it is not true. It is not a fact. It is something that these media houses may be reporting out of some compulsion, or maybe because of the lack of understanding of the issue. So you see, it is very clear that a discerning.
No, it was very clear that it was a political statement of some achievement.
Yes.
By 15th August.
Yes, and it continues to be. So there's a term now for that kind of reportage. It's called, and it's not just reportage, it's that kind of advocacy. It's called vaccine nationalism, which is happening across the world. There's a Russia which says that claims that we have the first vaccine. There's a China which covertly says we are the ones who are giving you the world the first vaccine. There's an India which says the same. It's media houses are mouthing these vaccine nationalistic stories from the policymakers, and many of them are doing so out of ignorance, not so much of political compulsion. I wouldn't say, maybe some compulsion of funding, which many media houses receive from government advertisements. So yeah, it's a mix of all of those issues, but most responsible media houses and journalists did report this issue as it is.
Okay, so actually now we are running out of time, but there is last question, and if you could kindly give a short answer. Question is asked by Dr. Chandramohan Nautiyal, and he's saying that to what extent scientists should be given freedom to vent their thoughts, especially on policies. Let us not forget that most of the scientists are in government-funded institutions.
Absolutely. This is the sorry state of science communication in one simple question. And as I said during the track on science communication, I did advocate to the policymakers of this country who are formulating the next science policy that every scientist who's doing public funded research in this country should be able to communicate his or her views without having to go through the channel of taking permission from his boss or DG or whichever policy making body it is. And that should be a universal policy, period. I mean, I can't advocate for science communication in the absence of the scientists of this country being freely able to give, voice to their thoughts. We have to remember that this obviously needs training. How somebody should and must and will communicate their science and their other thoughts beyond science to the public efficiently, effectively, responsibly, and ethically is a matter of training and is a matter of something that needs scientists to be held responsible for. Just as you're responsible for your publicly funded research, you should be responsible for what you communicate about that research and beyond that research. So yes, I fully support the view that science communication must be made much more open-ended. It must be democratized. It shouldn't be a top-down approach. It should, everybody should be able to do that. In the same vein, I do advocate efficient and effective communication through training and scientists understanding their responsibility through this kind of communication.
Thank you, ma'am. At the end, I would request Dr. Shobna if any comment you want to make.
I have made several comments. I agree with Shubhra fully about science communication. And if I may present the scientist end, it is, as you say, it is a training required. Maybe it should be made, as I said, part of a curriculum as to, there are now courses which teach you how to write, but you know, teaching you how to go for an outreach, that is not very easy for everyone. There are some people who can do it much better than the others, and maybe each organization should have such persons who can, you know, clearly bridge this gap. But yes, ethics and you know, the weightage to the work is something that is decided by each person, scientist or otherwise. You know, I mean, some people end up saying, I have the vaccine, and some people will say more carefully, we are working towards the vaccine in this particular manner. So that's where I think the communication matters most. Unfortunately, the public takes the media, especially visual media, television, these days WhatsApp or whatever social network. So anything which goes viral is immediately, you know, caught up with, and we have to make sure that proper scientific information gets transmitted to the general public. And I'm sure people like Shubhra and other communication persons have this responsibility along with scientists, of course.
Yeah, thank you. So now we have time limitations, so you have to conclude this. At the end, on behalf of INSA-INYAS colleagues, and on my own behalf, I wish to thank Dr. Subhra Priyadarshini for sparing time to share her views in such a candid manner. We believe that our viewers, or in particular young researchers, have found it very useful and must have addressed their concern on this very relevant topic. We also thank Professor Shobna Sharma for her gracious presence. For the information to our viewers, we will meet again on the same platform on August 17 at 11:30 with another eminent speaker, Ms. Kiran Majumdar-Shaw. You can follow this discussion and further updates on our official YouTube channel. Till then, take care. Goodbye. Goodbye.